We're talking to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health. Blood pressure, cholesterol, blood sugar levels all affect heart health. If you want to be as healthy as possible, like me, you also want to understand what all these numbers mean, and I get confused. It's important to know what your levels mean. Dr. Brent Wallis from People's Health now joins us to share why it is important to know those numbers. Morning, Doc. How are you?
Hey, Tommy. I'm doing good. How about you?
I am great. Thank you, sir. Let's talk about blood pressure. We know of it, but I don't think we really know what it is.
Yeah, sure. Blood pressure is basically the pressure that the heart makes against your blood vessels when it beats. And we check it usually at every appointment when you go to the doctor because it's a good indicator of general health. Actually, after age 40, you should absolutely have it checked at least once a year. And it's always recorded as two numbers. So either like a 120 over 80 means a top number and a bottom number is what we usually record.
Is that perfect, 120 over 80?
Yeah, 120 over 80 is where you want to be. And when we talk about those numbers, that top number is the force when your heart beats, whereas the bottom number is the force when your heart is relaxed. And so both those numbers are very important because you don't want to have a high pressure against any of the blood vessels in your body because that can lead to problems. So usually we target 120 over 80 or less than that for a normal blood pressure. If you're up to 130 for that top number, then that's elevated, and you want to kind of keep an eye on that. But definitely once you get up into 140 on the top number and 90 on the bottom number, that's hypertension, and that's something that a lot of times needs to be treated with medication.
You don't really need to go to a doctor to get this checked, can you?
No, you can. There's a lot of over-the-counter blood pressure cuffs that you can buy at some of the drugstores. In fact, People's Health and other Medicare Advantage plans have an over-the-counter benefit that you can use to buy that. And actually, I tell all my patients that if you do have elevated blood pressure, that you should get one of those cuffs so you can keep an eye on it when you're at home and not just when you go to the doctor.
So what does it mean if your blood pressure is high?
Yeah, so when it's high, and that's very common, what you have to worry about is that high pressure causing any damage to either the big vessels in your body or the small vessels in your body. And the small vessels are the ones that are in your kidneys or your eyes, so you have to be real careful about possibly developing problems with vision or problems with your kidneys. The bigger vessels are the ones that are in your brain and then also in your heart, so it can lead to things like stroke and heart attack. So that's why it's so important.
I always tell people in my own layman way that, and I have high blood pressure, so I take the medication and it's under control, but how a lot of times it's nothing you're doing. It's all about family history. It is a very simple thing to take care of, but a very serious thing if you don't. How common is high blood pressure, Doc?
Yeah, it's extremely common. In fact, it's the most common thing that we see in internal medicine and primary care. It's about 9 out of 10 Americans over the age of 50 have high blood pressure. And the part that's real dangerous about it is that most people don't have any symptoms at all, especially at the beginning. So it's a very silent disease that we have to identify, and then treat it if need be.
Man, and if you're on blood pressure medicine, take that medicine. I can't emphasize that enough, Doc. I hope I'm not being melodramatic, but it is very important.
No, it's very important, and I think the other thing to keep in mind is if you are on medication and your blood pressure comes down, you're going to feel great, and that's what's intended, but it doesn't mean you should stop the medicine at that point. You need to actually continue it so your pressure stays in the range that it needs to be.
Victim of your own success. Why am I taking this medicine? I don't need it. Well, you don't need it because you're taking the medicine. That's why you feel well. We're going to take a break. We'll talk about cholesterol when we come back. Dr. B, Dr. Brent Wallis, spending some Thursday morning with us, as he always does. He's the Chief Medical Officer of People's Health. We're discussing senior health, and we're talking about all these different numbers that fly around when you go to the doctor's office. What do they mean, and how important are they? Time for traffic now on WWL. Tommy Tucker, WWL. It is 8:25 Thursday morning, talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer for People's Health. And today we're talking about the numbers that you hear and that doctors talk about, and sometimes they fly around the examining room so quickly you don't quite know what is what. So let's talk, Dr. B, about cholesterol. What is it, and where does it come from?
Sure. So cholesterol it's like a soft, fatty substance that's in everyone's body. So absolutely everyone has it because it's necessary for life, and you use your cholesterol in your body to produce cells and nerves, and it actually is contained in a lot of hormones in your body too. So it serves a lot of really good functions, but you have to keep in mind that there's good and bad cholesterol. Your body actually produces the majority of cholesterol that we see when we check your blood. About 75% of it is produced in the body. The other 25% is what comes from eating, so diet, foods that are high in animal fats and items like that can actually raise your cholesterol as well.
I and a lot of other people get confused about good and bad cholesterol. Can you kind of go into that a little bit?
Yeah, sure. So there's two major types of cholesterol. So HDL is the good cholesterol. So that's the one you want to have more of. And HDL kind of works as a scavenger. It floats around the body and actually helps to clear the bad cholesterol away. The bad cholesterol is called LDL cholesterol, and that's the one that can actually cause inflammation in the blood vessels and can actually result in plaques that can clog the arteries, and that can lead to things like heart attack and stroke. So the way I usually tell people to remember it is LDL with the L is lousy cholesterol, and HDL is the happy cholesterol. That's the one you want to have.
That's a good way to remember it, actually. What are like the numbers we're shooting for here as it relates to levels for cholesterol?
Yeah, you'll hear a lot of levels with cholesterol. So the way you really want to think about it in general is what's your total cholesterol. So we use a calculation that includes both your LDL and your HDL, as well as your triglycerides, and we calculate a number. So you want to target below 200. That's what would be desirable. Anyone who's above 240 is definitely high cholesterol, and depending on other risk factors or other chronic medical problems you have, that's when you may have to talk to your doctor about being treated. Anybody who's in that in-between range, the 200 to 240, usually we can address that through diet and exercise.
Couple of minutes left. Let's talk about blood sugar. What is it, and what are those ideal numbers?
Yeah, blood sugar is very important, and most people associate it with diabetes. So blood sugar numbers that you want to remember are really always taken fasting. So when you eat, your blood sugar naturally does go up. So if you want to get an accurate reading, you really need to have it checked first thing in the morning after you haven't eaten anything. And the target that we shoot for is less than 100. If you're actually greater than 126, then that would be considered diabetes. And then the people that have fasting blood sugars that are between 100 and 125, that is usually considered pre-diabetes. So pre-diabetes, in about 5 years, if you don't do anything about it, can quite often progress to full-on diabetes as well. And there's one other number that we look at with blood sugar that's called an A1C, and this is the one anyone who's a diabetic should always know what their A1C is. What that's measuring is how much sugar is stuck to your red blood cells. And so that number is really important because it gives us an idea of what your average blood sugars were over the past couple of months. So it's not a single value. It really tells us a range. And you want to target something below 6.5 because 6.5 is actually kind of the cutoff for what we consider diabetes.
Doc, we only have about 45 seconds left, and diabetes is very important. So I'm going to finish this up after the news, if that's okay with you, because I know it's important information and I want people to have it.
Yeah,
Dr.
great.
B, Dr. Brent Wallis, our guest, Chief Medical Officer of People's Health, Senior Health, talking about all the different numbers as it relates to blood pressure and cholesterol and blood sugar. And diabetes is a big problem for a lot of people, and it can be controlled, although there are different types of diabetes. We'll go into all of that when we come back. If you have any questions or comments, text them to 504-260-1870. We pause now for WWL First News, and for that, we go to David J. Cohen. Back to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. As we're talking about senior health, and it is important to talk about diabetes, Doc, we've already gone through prediabetes and diabetes, but how common is it? And if you ignore your blood sugar levels, what are the complications?
Yeah, it's very important because it is so common. There's about 30 million Americans in the country with diabetes, and probably a quarter of those don't know it yet. They haven't been diagnosed. In addition to that, there's probably another 84 million that have prediabetes. And like I said, if you don't get the prediabetes treated, then often that can lead to full diabetes within 5 years. So really what you have to worry about with diabetes is the impact of that high blood sugar. It can lead to a lot of serious problems like heart disease, heart attack, and stroke. And heart disease itself is actually the leading cause of diabetes-related deaths. Diabetics are actually 2 to 4 times more likely to die of heart disease than anyone without diabetes. So, and like I mentioned before, it also damages small vessels in the body, much like hypertension can cause some problems. So in the kidneys and nerves, and then also in the eyes. So that can lead to blindness or dialysis, and unfortunately can even lead to some limb amputations. So that's really why it's extremely important to know what your numbers are and make sure your diabetes is diagnosed and then well treated.
Final word of advice for listeners?
Yeah, I mean, I think the takeaway here is the numbers are very important, and us physicians will throw these numbers around, but we want the patients to listen and really understand what they mean, especially because there could be a situation where you're not talking to your doctor, or maybe you need to access care somewhere else, like an urgent care or with another physician. And it's really useful information if you can tell them what your numbers are, because it can help them decide what they need to do to help treat your condition. So make sure you know those numbers.
Thank you, Doctor. I appreciate the extra time, and it's very important. That's why we wanted to get to it. You can visit. Have a good week, Doc, and a good weekend.
Thanks, Tom.
You can visit peopleshealth.com. You can call 1-855-821-2666, 1-855-821-2666. And you can follow People's Health on Facebook, Twitter, and Instagram. We're going to